we are live.
Hey guys, Matthew here at Dr. Jason Emer's office. We're here with our one-day post-op patient who just got high-definition liposuction. So if we can take a look at his before picture, this patient wanted high-definition sculpture here to redefine his abdomen. And then we actually did a fat transfer to the chest. If you guys get close, you can kind of see here. A little misshape, and that's okay. So we added fat to the top of the chest. And then this is a different
And then one more
angle.
time for those that just tuned in, tell us what you...
Welcome guys, Matthew here, Dr. Emer. So what we're doing is we're with our patient who's getting lymphatic massaged right now, one day post-op. So he had his surgery just yesterday, and he did a high definition liposuction, and he got abs now showing and fat transfer from the fat that we removed to the chest and the buttock, but we're only looking at the chest right now. So let's look at the patient now. Look at the sculpturing here. The definition of the abdomen is really showing. This is just one day post-op, and then we have up here at the chest, if you guys come in closer, you can see this definition here on top. Now he's lying down. When he's standing up, this is going to look even better. Now, you know, normally with our other patients, we've done even fat transfer to the deltoid. We didn't need to do that with this patient here. He already has definition there. But look at all the shaping on the side, the serratus anterior, and then the abdomen here is, the markings are still there from surgery. I mean, you can see he's gonna get a great result. All this has been removed. It's gonna be flat, and then look here. This is where all the curvature has been removed and fat has been transferred to be on top, on the superior part here.
Man, this is what he looks like now. You guys could already see some contouring of the abs, and this is just one day post-op. He's still swollen, is that right?
Yep, he's very swollen. It's a one day post-op, but he's doing all the post-op procedures. So our protocol, we're doing an IV therapy right now while he's being massaged, which is super convenient. This is packed with minerals and vitamins that are gonna help balance those electrolytes that you normally lose when you're losing a lot of fluid and volume from the body. In addition, he's doing hyperbaric oxygen chamber, which is concentrated oxygen, help those tissues to repair and revitalize and reduce that swelling, any bruising, and overall increase the healing.
Now, Michael, let us know exactly what you do and what you're doing.
Exactly. So what I'm doing is manual lymphatic drainage, and this is super important after any of our procedures, just to make sure no scar tissue is forming, making sure that we're getting all rid of the tumescent fluid, as well as any fluid from the procedures, any of the anesthesia as well. And then as well, we're making sure just to go over this area so no scar tissue forms, so no irregularities, and he gets that beautiful contour look.
So you're saying if they don't do this, people can suffer from...
Absolutely, for seromas, and that's a fluid sac, and that's something you definitely don't want. It will definitely mess up the look of what you're trying to achieve here, but more importantly, yeah, definitely want to make sure we're getting as many manual lymphatic sessions as possible. We recommend anywhere from 7 to 14 sessions, just depends on the procedure, what you're having done, as well as combining it with the hyperbaric chamber and the IV therapy.
And again, he's out just not even 24 hours now. Would you say, based on your experience from all the patients you've done, Michael, is it painful?
Definitely not painful, but definitely for the first, say, 72 hours, going to be more on the sensitive side, but definitely not painful. I wouldn't describe it as painful, more sensitive.
And again, he did HD-Lipo, look at his stomach, and then back to Matthew to let us know.
Yes, also with our IV, some patients choose to do NAD therapy. Some of you guys have heard of that. NAD therapy, these IVs, they're not only for post-op patients, they're great for mental clarity, overall healing. So generally, anything we do post-op is going to be great for every day. You can come in and get it on a weekly or monthly basis. And just overall, the hyperbaric, all these things are going to help our patient just improve and have a lot less downtime.
Now, these fluids, or this procedure itself, now, can this just be for HD-Lipo patients, and it's just for the stomach? Michael?
Are you talking about the lymphatic?
Yeah.
Now, lymphatic can actually be anywhere on the body, and as we know, our lymphatic system is our highway of our protectant layer in our body. So it's a fluid highway. So any bacteria or viruses goes through that highway, and that's where our lymphatic system right now is a little overworked. So doing the manual lymphatic drainage is helping that system divert the fluid out and through that system as well. So our patient's swelling not only could be, from the tumescent fluid, but also we want to help that lymphatic system drain, and he'll essentially urinate everything out as time goes on.
Now, Michael, walk us through what you're doing at this very moment. Why are you doing that? Why are you doing it there? What's happening?
Absolutely. So what I'm doing, like I was saying before, is definitely lymphatic massage. I'm just making sure to push all the fluid outside the drain incision sites here, and just making sure that as much fluid as we want to get out, just like Matthew was saying earlier, the body will reabsorb some of this fluid as well, but especially within the first 72 hours, we're making sure, just to make sure that all this blood flow from the anesthesia as well, and the tumescent fluid from the liposuction is out of the body as quickly as possible.
Now, Matthew, do you mind bringing in the eye patch just a little closer?
Yeah.
And then tell us maybe the other picture, and then let us know what was done and kind of compare it to
Of course.
what we're looking at.
So Dr. Emer creates small ports here in different areas of the body where he's going to use his catheter to go in with the liposuction. He's going to heat up the fat using numerous technologies that a lot of doctors don't combine to use this procedure. And he's actually going to remove the fat, and at the same time he's going to create a sculpting effect where the patient currently has his abdominal muscles.
You could see it already too, like on the patient.
Yeah, I mean, if you look, you can see right here where we delineated some areas, that's where his abs are underneath. So creating those sculpting lines, that shape, we can really show and exaggerate. So after surgery,
So put it in the middle so we can compare it, and then this is what he looked like before, and then remove the picture. This is what he looks like now, and he's still swollen now because he's just not even out 24 hours, and he's still healing. And how long is the healing process?
the healing process can take up to 6 months, even to a year, to really fully see those results. And during that time, anything you do is going to have an additive effect to really exaggerate those results. We have TrueSculpt Flex, we have radio frequency, we have different things that can help tone and really exaggerate those results too.
Now tell us about TrueSculpt Flex. You did one yesterday, and where do you put, like, say
Yes.
this is a patient right here, tell us what would happen.
Exactly. So as we see the before, he didn't really have those abdominal muscles showing, and now we see where they are and where they're going to shine through, and he's going to have a beautiful six-pack. And TrueSculpt Flex, we put the nodes here and also on the obliques, and what that's going to do is actually contract the muscles just as it would if you were working out. So it's essentially the same as doing 1,000 crunches in a single session.
So again, you said lymphatic, TrueSculpt, hyperbaric chamber,
And radio frequency as well. So
and
that's
I'll
gonna
help
tighten-
do. And I'll help do what?
It's going to help tighten the skin, remove drainage, and provide that optimal result in a shorter amount of time.
All right, guys. Once again, this is his before, and this is his after, and that's Michael. So you guys can see he's draining, and that's not just blood. This is fluids.
Masculine fluid, anything from the procedure, as well as a little bit of anesthesia, and anything that had to numb him up with.
And not just for those that come to Dr. Emer, anybody else that goes to any other doctor, we could do this for you too, and this is very important. Michael specializes doing this, and then doing the lymphatic massage, draining it, that way you guys don't have any complications. And then Matthew's in charge of making sure you follow up with something like a hyperbaric chamber, radio frequency devices, which are all important for a better healing and that contour, that six-pack. Check that out, guys. All right, and that's it, guys.
Thank you guys for tuning in. Catch you guys later.